Dr. Guy Leschziner is a leading neurologist and sleep physician based in the UK. He studied medicine at Oxford and Imperial College, specializing in neurology and sleep medicine. From 2013 to 2023, he ran one of Europe's largest sleep disorder centers at Guy's and St. Thomas Hospital in London. Over his career, Dr. Leschziner has conducted over 25,000 sleep studies on more than 100,000 patients. His research and clinical work focus on understanding the extremes of human experience related to sleep and neurological conditions. Dr. Leschziner emphasizes that sleep is fundamentally important for human health and functioning. The fact that we spend about a third of our lives sleeping, despite the vulnerability it creates, indicates its evolutionary significance. Sleep is crucial for nearly every aspect of our waking lives, including immune function, cardiovascular health, mental health, and pain perception. Dr. Leschziner notes that while public awareness of sleep's importance has increased in recent years, many people still underestimate its significance. According to Dr. Leschziner, about 20% of adults are chronically sleep deprived due to lifestyle factors. Around 30% experience insomnia in any given year, with 10% suffering from chronic insomnia lasting over 3 months. Other common sleep disorders include obstructive sleep apnea, affecting 10 to 12% of adult males and 6% of females, though 80% of cases go undiagnosed. Restless leg syndrome impacts about 5% of adults, while 1 to 2% experience sleepwalking. Dr. Leschziner discusses how modern society contributes to sleep issues, with insomnia being relatively rare in pre-industrial societies. Genetics play a role in determining individual sleep needs and patterns, with some rare individuals genetically predisposed to require only 4 hours of sleep per night. The circadian rhythm, our internal 24-hour clock, is influenced by both genetics and environmental factors like light exposure, eating patterns, and exercise. Blue light from electronic devices can disrupt this rhythm if used excessively before bedtime. Sleep deprivation can have significant impacts on physical and mental health. It increases the risk of weight gain by affecting hormones that regulate appetite and satiety. Even a single night of sleep deprivation can dramatically increase calorie intake. Sleep deprivation also affects glucose tolerance and insulin resistance. Cognitively, sleep deprivation causes parts of the brain to experience brief periods of electrical silence, leading to decreased cognitive performance and increased emotional reactivity. Dr. Leschziner emphasizes that the majority of sleep disorders can be effectively treated. For insomnia, cognitive behavioral therapy for insomnia, CBTI, is considered the gold standard treatment, helping about 80% of individuals. This approach aims to address both conscious psychological factors driving insomnia and unconscious associations between bed and wakefulness. While sleep medications can be helpful in some cases, he generally recommends non-drug approaches first. Dr. Leschziner expresses some reservations about the widespread use of consumer sleep tracking devices. While they can be beneficial for research and for some individuals to gain insight into their sleep patterns, he cautions that they may increase anxiety in people already concerned about their sleep. He notes that these devices are generally accurate at measuring time in bed, but less reliable for detecting specific sleep stages or nighttime awakenings. Dr. Leschziner shares several fascinating cases of unusual sleep disorders he has encountered in his practice. These include individuals who have committed crimes while sleepwalking, including one case of a person driving several miles and committing murder while allegedly asleep. He explains that in such cases, parts of the brain responsible for rational thinking and memory formation may remain asleep, while other areas controlling movement and basic functions are awake. In discussing his book, The Man Who Tasted Words, Dr. Leschziner explores how neurological conditions can dramatically alter an individual's perception of reality. He describes cases of synesthesia, where senses are blended, such as people who experience tastes when they hear words or see colors when they listen to music. These examples highlight how our perception of reality is intimately linked to the structure and function of our brains. Dr. Leschziner's upcoming book, 7 Deadly Sins, examines how neurological and psychological conditions can influence human behavior in dramatic ways. He discusses cases where brain tumors, strokes, or even medications have caused significant personality changes or aberrant behaviors. These examples raise profound questions about free will and moral responsibility, suggesting that our actions may be more influenced by brain function than we typically assume. Dr. Leschziner shares several striking cases from his clinical experience and research. One particularly impactful case involved a young man with a genetic disorder that prevented him from feeling pain, leading to severe injuries throughout his life. This case underscores the crucial role that pain plays in human development and survival. Another case involved a woman who lost her vision but began experiencing visual hallucinations, illustrating how the brain creates its own inputs when starved of sensory information. Reflecting on his work, Dr. Leschziner acknowledges the emotional toll of encountering such extreme cases. He notes that the time constraints of busy NHS clinics can sometimes make it challenging to fully appreciate the broader implications of patients' conditions on their lives and families. Writing books and engaging in deeper conversations with patients has given him a greater appreciation for the wide-ranging impacts of neurological and sleep disorders. Dr. Leschziner offers several recommendations for improving sleep. 1. Maintain consistent sleep and wake times. 2. Create a dark, quiet, and cool bedroom environment. 3. Avoid excessive use of electronic devices before bedtime. 4. Be cautious with caffeine and alcohol consumption, especially in the evening. 5. Establish a wind-down routine before bed. 6. If struggling with insomnia, consider seeking professional help, particularly cognitive behavioral therapy for insomnia. He emphasizes that while these general principles are helpful, sleep needs and patterns vary between individuals, and it's important to find what works best for each person. Dr. Leschziner highlights several areas where our understanding of sleep and the brain remains limited. The function of dreaming, particularly REM sleep, is still not fully understood. The relationship between sleep and conditions like Alzheimer's disease is an active area of research, with some evidence suggesting that changes in sleep patterns may precede the onset of cognitive decline by many years. The exact mechanisms by which sleep deprivation affects emotional regulation and decision-making also require further investigation. Dr. Guy Leschziner's work in sleep medicine and neurology provides fascinating insights into the complexities of human consciousness and perception. His research and clinical experiences underscore the critical importance of sleep for overall health and well-being, while also revealing the profound ways in which neurological conditions can alter our experience of reality. As our understanding of the brain and sleep continues to evolve, Dr. Leschziner's work reminds us of the intricate relationship between our neural processes and our lived experiences, challenging our assumptions about the nature of consciousness, free will, and human behavior.